Hi, everyone. Welcome to another episode of the Premier Life podcast. Dr. Kaytlynn here, and we're going to be talking today about why C-section rates seem to be on the rise. I was doing a pregnancy consult with a practice member within the last couple of weeks, and she was talking to me about how she is currently pregnant with her second child. And so the conversation kind of got started around what, the normal birth or what we say a typical birth looks like. But part of that conversation has really grown to evolve around things like C-sections and inductions. Now, there's a study published by the American Medical Association that in 1990, the number of births that were C-sections was 7%. As of 2023, that number has increased to 32.3%. So we have grown drastically in a period of about 30 years in regards to the number of C-sections that are being performed in the United States alone. Now, there's a lot of different talk as to why that is the case. There are some positives to that. There are some negatives to that. And so we're going to dive into a couple of those things. So one of the reasons that C-sections have gone up so greatly is partially due to mom's preference. They either experience a very traumatic first labor delivery with their firstborn, and then they don't want to go that route again. There's a lot of anxiety that hangs around the birth talk. There's a lot of just feeling overwhelmed and fear. And so sometimes moms just opt for a scheduled C-section because it reduces that amount of anxiety, fear, and just negative association with birth in that way. Unfortunately, one of the other reasons that C-sections have gone up is purely because of physician and provider preference. We've gotten to the point where moms start to hit that 39 weeks and doctors are just more comfortable saying, hey, we're going to schedule an induction, we're going to schedule a C-section because it's easier for them in regards to having more control of the outcome rather than making moms wait until 40 to 41 to 42 weeks, even though that is the normal gestation period. We talk about, gestation being 40 weeks, and actually more often than not, a normal gestation period is actually 42 weeks. But a lot of providers don't let moms go out to 42 weeks because they say it increases the likelihood of more severe things starting to happen. So unfortunately, that provider preference on wanting to schedule C-sections and have it within a specific windows when they're in the hospital rather than to be on call is unfortunately a harsh reality of the conversation in regards to why C-sections have started to arise. Now we have some positives on why C-sections can be beneficial, and we have some negatives on why C-sections cannot be beneficial. Don't hear what I'm not saying. C-sections can be super, super, super important and super needed in a lot of situations in regards to mom's life being at risk and baby's life being at risk. Okay, so don't hear what I'm not saying. C-sections are needed in some cases. My argument today is just to get you thinking a little bit deeper about why they've started to increase and should we have increased the rate as drastically as we have. So some of the positives, like I said, it can save both mom and baby's lives. Sometimes baby fails to descend and mom is starting to have blood pressure issues or blood sugar issues or, is going into more of a shock-like situation in regards to needing to get baby out sooner rather than later. In that case, a C-section is really, really, really necessary in order to provide the best results going forward for both mom and baby. So it can save lives in necessary situations. However, there are some negative consequences to C-sections, even when saving a life is needed. Okay. One of the biggest things that happens during that birth process is that as baby descends, it passes through the vaginal canal and out into the world. There is so much important microbiota and bacteria and other things that line the uterus down and out through the rest of the body that baby really needs in order to develop the immune system that's essential for life after birth. So in babies that aren't born via vaginal delivery and are born via C-section, we start to see an increase in the rate of non-communicable diseases such as asthma, allergies, type 1 diabetes, obesity, things like that, because of the fact that they're not getting the exposure to that essential microorganisms, bacteria that they need in order to develop strong immune systems later in life. Another side effect, unfortunately, of C-sections is we are performing surgery. And so there is an increased likelihood that mom has more drastic outcomes in regards to increase in mortality. So mom is at a higher likelihood for hemorrhaging. She's at a greater likelihood for things like hysterectomies. It just puts more pressure on mom's body because she's now having to recover not only from childbirth and the steps leading up to that with labor, but also we have now created incisions, increase the likelihood for bleeding, increase the likelihood for negative effects. And again, there's that risk anytime we do any type of surgical procedure. The other thing that starts to happen as babies start to descend is it's this unique process that the brain needs to go through in regards to developing things called primitive reflexes. Now, I did a podcast on primitive reflexes a number of months ago, and that's basically things that the brain needs in order to develop skills later in life. So as the baby starts to descend down the birth canal, it does this rotation type thing where it tucks the shoulder, and then it does this extension mechanism in order to fully get out of that vaginal canal. Now, those primitive reflexes that are needed are things that then translate 6 to 9 months down the road in regards to baby learning how to crawl and learning how to walk and learning how to sit up and then learning how to pull itself up. So sometimes when those primitive reflexes aren't integrated as the birth process actually occurs, and they're just pulled out via C-section, then the brain doesn't get that initial integrative primitive reflex into the brain, and so it doesn't know how to do that. So then we start to see some developmental things that might progress further down the road. Okay, so why, in addition to all these positive and negatives, why is the rate of C-section starting to increase? And again, we talked about, physician preference and, fears of mom. But the other harsh reality is we have to talk into how those types of things like inductions and those extra measures that some physicians take in order to assist with birth and delivery are actually the cause on why C-sections start to happen. Think about it like a snowball that starts at the top of the mountain. And as that snowball rolls down the mountain, it gets bigger and bigger and bigger, and it gets to the point where it can't stop rolling anymore. When we start to do things like inductions actually increase the likelihood that a C-section is needed down the road by 39 to 43%, as suggested by different studies. Okay, so there are some moms who go into the hospital who either, can't get the birth process started, or there is a delay in labor. And so the physicians and the OBs say, hey, let's do an induction, or let's administer Cytotec, or let's administer an epidural to kind of help you continue on with labor if we're starting to fail to progress. But the issue is that the second we start to do those other interventions, the likelihood of having to go in for emergency C-section several hours later increases drastically. Okay, so what starts to happen in a typical induction, because there's lots of people who don't understand this, both females who are going in for their first delivery and also a lot of dads, first-time dads, they don't understand the process. So in order for labor to be initiated, the cervix over the last couple of weeks leading up to delivery starts to soften and starts to dilate. In order for baby to completely emerge from the vaginal canal, it has to reach 10 centimeters. So there is a drug that they administer a lot of times in the hospital if that cervix doesn't start to dilate. It's called Cytotec. So they stick that in there, and what it starts to do is it starts to cause that dilation so that cervix can become bigger and bigger, ultimately reaching our goal of 10 centimeters, which is when most trained birth professionals know that that's when labor is actually at its peak and when actual delivery and emergence of that baby's head can start to occur. Okay, after a lot of times when Cytotec is delivered, there is a failure of the amniotic sac to break. So a lot of times they'll have to manually go in and break the water, which helps to start that labor process and start to progress that a little bit more. A lot of times you'll hear people say, hey, I was given Pitocin. Now, Pitocin is a synthetic form of oxytocin, and a lot of you may know that oxytocin is our love hormone, but it's actually what really gets that contraction period started. Mom releases oxytocin in a natural vaginal delivery, okay? That communicates with baby. Baby recognizes the oxytocin and releases its own hormone, which then communicates with mom to start that contraction process. Okay, so think about it like a dance. One person steps this way, the other person steps this way. And as long as we start to have that wave and that correct rhythm, contractions go as planned, okay? So we start to get baby descended and everything goes well. Now, this is not always a short process, but that unique dance and rhythm is what we need for labor to progress the way that it does. The problem with Pitocin, which is a synthetic form of oxytocin, is baby doesn't recognize that as mom signaling, hey, it's actually time for labor to start. So what actually happens is as mom releases or has that artificial oxytocin in her, baby doesn't necessarily recognize it, but baby is also trying to emit its own hormones, but the signals don't intertwine and don't connect. So actually what happens is it starts to become this tug of war where mom is starting to contract because the Pitocin is telling the body to contract the uterus, but baby isn't ready. So it's this tug of war back and forth and back and forth and back and forth. And so that can actually make labor harder on moms administering Pitocin because baby isn't yet ready to be born yet. So when that happens, it actually puts more stress and strain on babies. Moms get to the point where, labor gets stalled, which then results in an OB saying, hey, we actually have to do something because mom has failed to progress and we got to get baby out because it's causing decels in baby's heart rate, it decels in baby's breathing, and it starts to put baby under stress. So if we stopped administering Pitocin as much as we did, we would start to notice that mom actually knows exactly what to do and the timing, and baby recognizes that, and which labor actually needs to be initiated. A lot of the other issues is that we administer epidurals, and epidurals is a way to decrease the sensitivity and the sensation from the waist down to make it a little bit easier on mom if contractions and labor is painful. The issue with epidural is that once that is administered, it's a big long needle that goes into the bottom part of mom's spinal cord. But because we're decreasing the amount of sensation and the feeling that mom has, hospital policy is that moms have to stay on their back. Now, when they're on their back and they're trying to push during delivery, they're actually pushing up against gravity because their legs are up in the air. And it makes delivery that much harder because mom isn't able to get into a favorable position as she's stuck on her back and she now has to push against gravity rather than being able to have feeling sensation without an epidural and is able to stand up and help use gravity to help get baby out of the birth canal that much easier. So we start to look at all of those things and it's like, okay, no wonder all of these extra interventions that we use to help labor and help delivery can actually increase the likelihood of C-section because it's not doing it as the body was designed to do. So some of the ways that we can do to avoid these C-sections, especially if people are going into the hospital saying, I don't want this, is just to prepare mom for labor and to prepare mom for delivery. And that looks a couple of different things. One of the best things is to have a really good birth team. Okay, so there are a lot of options nowadays with people going the route of a midwife or a doula or having a birth team who actually understand the birth process and all of these interventions and is able to advocate for you and the things that you want. Because at the end of the day, your birth team works for you and this birth is your birth. It's not about what any other provider wants for you. Another great way is to work on breathing exercises, different sort of like pelvic floor training. Spinning babies is a great resource, especially for moms, if baby is not in the most favorable position, but also to get the body just ready for that pushing, ready for the contractions, ready for labor. And then the last thing that is super important just to support mom throughout pregnancy and to prepare that body for labor is chiropractic care. Making sure that the nervous system is regulated, making sure that the body is communicating with the brain as much as possible to ensure that all of those other medical interventions are not necessarily needed, and we can avoid C-section if that is not the way that moms need to go or want to go. So hopefully this helped open your eyes a little bit more to, the importance of C-sections when needed, but also just opening your eyes to things that we can avoid if we want to go the route of a natural vaginal birth rather than a C-section. I hope you have a great rest of your week.